Hi, good evening everyone. I'm Dr. Tani Ping, consultant obstetrician and gynaecologist. Why? Because if let's say you are taking some contraceptive pill, if you're taking contraceptive pill, or maybe you are having an IUD inside you must understand when you have IUD and when you're pregnant, they still bleed one. And then if you take oral contraceptive pill, sometimes when you're pregnant, you still continue to bleed. You will have this bleeding that will come because pregnant still taking pill is not normal. So this abnormal situation can also cause bleeding. More common that I see is those people who take emergency contraception, or simple they call it morning after pill. Morning after pill is the pill that you take after you have sex, it's like emergency. That's why we call emergency contraception. And this type of pill, they actually tend to cause a lot of funny bleeding. And if you continue to take every now and then you have sex, because I know women who take emergency contraceptive pill for long term one. Every time they have sex, they take it. Every time they have sex, they take it. That's why this type of women, I always tell them, don't take morning after pill long term. You're supposed to take as real emergency that you take once and that's it. And then you must think about what you're going to do next as a permanent long-term contraception. So if they take emergency contraception, I always tell them, you'll be pregnant until you don't know. Because they still bleed. So when you bleed every month, you may think that you're not pregnant. And especially for women who menses not necessarily every month, same time, Sometimes a bit late, sometimes a bit early, sometimes a bit late, sometimes a bit early. So if you have IUD or you have a contraceptive pill or you take emergency contraception, you can also have bleeding, sometimes early, sometimes late. And you don't even realize you're pregnant until maybe 9 months. Because when you don't know you're pregnant, sometimes women when they don't know they're pregnant, baby kick also, they don't realize baby kick. They don't realize anything they just go on as though everything is okay. Their tummy get bigger, they think they're fat, and they go on diet. So things like that, you can actually drag on for all 9 months, and then suddenly, oops, give birth already 9 months, and then they have period for all 9 months, but they're actually pregnant. Brownish discharge means you have some amount of bleeding. So you're having bleeding during pregnancy. And you are now 5 weeks pregnant. So 5 weeks is about the time where we say implantation bleeding is supposed to happen. But for implantation bleeding to happen for so many days, it's a bit abnormal. So in this type of situation, I wouldn't think about miscarriage so much yet, because miscarriage usually, I would think if it's later in 5 weeks pregnancy, you can still bleed due to many other reasons. It can be normal, it can be not normal. Not normal also, it can be due to pregnancy problem. It can also be not due to pregnancy problem. Like I mentioned earlier, maybe you got fibroid, maybe you got polyp, maybe you got a cervical infection. So actually you don't know, you have to go and check. So you need to go and see a gynae, get ultrasound scan first. If ultrasound scan is normal, then the doctor will probably need to assess a lot of other things. So it can be due to pregnancy problems like miscarriage, ectopic. It can be due to problems with your uterus. Okay, so it can also be due to nothing, totally something that can happen in all pregnancies. Okay? See, if you every time have sex bleed, how to get pregnant? Because blood got a lot of cells that we call like Pac-Man. They like to eat up all the sperm. So when you have sex and you bleed, then all these cells will be there to eat up all the sperm. How to get pregnant? So when you have bleeding after sex, you want to get pregnant, you need to solve the bleeding. Well, and if you have bleeding after sex, and then suddenly you get pregnant, then during pregnancy you're definitely going to bleed also Okay, so my advice for all women out there is, if you have something abnormal that happens to you every day, don't make abnormal become normal. Okay, don't live with abnormality. Always make sure you're back to normal. We want to get back normal. So polyps that don't disturb you, don't disturb the polyp. Fibroid don't disturb you, don't disturb the fibroid. But if the fibroid is disturbing you, then you need to disturb the fibroid. You need to get back to normal. We need to be normal and be as normal as possible. Okay? I'm very happy that I can share knowledge to everyone here today. Okay, so that's all for tonight. Okay? Thank you and bye-bye.